Hello, I'm Matt Galloway, and this is the Current Podcast. Bob McBride has been using cannabis for most of his life. He's 80 years old and from the Ottawa Valley in Ontario.
Well, I smoke it occasionally, and I use gummies. I do either or both, maybe 2 or 3 times a week. If I had a gummy that had THC content of 5 milligrams, I might take half of it.
Bob isn't particularly worried about the dosage. He says he knows his limit and knows how to take cannabis safely.
It's enjoyable. It's relaxing. It stimulates me in conversation. It enhances a lot of the things that I do through the day. I think of it as a user-friendly drug that I have learned how to use responsibly. It's a recreational drug for me, and it's also a way I manage my pain.
Seniors are among the fastest growing age group using cannabis, and the number of seniors ending up in emergency departments with cannabis poisoning has also risen significantly since legalization. Dr. Nathan Stahl is a geriatrician at Mount Sinai Hospital, a scientist at Women's College Hospital, and the lead author of a new study looking into cannabis poisoning in seniors. Dr. Stahl, hello.
Hello, thanks for having me, Matt.
Thanks for being here. Why did you want to do this study?
Yeah, so you highlighted up front that seniors are the one of the largest growing age groups, or the age group with the largest growing use in cannabis overall. And little is actually known about the health effects of legalizing specifically edible cannabis on older adults. So, I agree with Bob. Most older adults are using cannabis, likely safely. Many know their limits. They're tolerating this. But, a couple things piqued our interest in terms of doing the study. First, there were the rising rates in use. Second, a study a year ago amongst Canadian children actually showed that legalization specifically of edible cannabis was associated with more poisoning amongst children. And seniors similarly are susceptible to unintentional ingestion, where unlike Bob, they're actually not trying to take cannabis. They unintentionally ingest an edible product because it's visually attractive and palatable, and maybe take it in error because it's easily confused with non-cannabis foods and candies. And thirdly, this is actually something I've seen clinically where an older adult actually comes to the emergency department with confusion. They're actually quite sick and they get worked up for common causes of confusion in older adults, a CT of the head to rule out a stroke, blood work to rule out infection or severe metabolic abnormalities, and nothing comes back. And then the toxicology screen comes back positive for cannabis, and it turns out they've unintentionally ingested cannabis. So those were sort of 3 of the main reasons why we chose to take this on.
You saw this in particular with an 80-year-old who was in hospital. Tell me that story.
Yeah, so I think when people think about cannabis poisoning, or taking too much cannabis, they think about someone who's coming in giddy, euphoric, maybe asking, to eat. I don't think many people think of this as someone who's, quite ill. But we were consulted in the emergency department as part of the geriatric medicine service at my hospital. And again, this older adult was, presenting in the way that individuals would present with very serious illness. Decreased level of consciousness, hallucinating, high blood pressure and heart rate, nausea and vomiting. And the usual sort of frontline investigations that are done in the emergency department did not reveal an obvious cause for why this older adult was so sick and unwell. And once that toxicology screen came back positive, it became evident they had cannabis in their system. And when we asked, how did this older adult have cannabis in their system, unlike Bob, who you spoke to up front, they weren't intentionally ingesting this. They had gotten into an edible product when they were looking to actually just have a snack. And, that's problematic for 2 reasons. One, they weren't actually intentionally trying to ingest cannabis. But secondly, when you're consuming a snack, you're very likely to take much more than you would in terms of the dose for edible cannabis. So,
how did their family respond when you said this is kind of what happened?
Well, it became obvious that one individual had realized that their edible cannabis product had been unintentionally consumed, and they were I remember sort of distinctly they turned sort of beet red and realized what had happened and what had led to this problem. And, there was I think, because it's so commonplace and because it's so socially acceptable now, edible cannabis products aren't necessarily always treated as a potentially dangerous substance if someone who's not intending to take it can get into it. So it was really shock and some embarrassment as well.
Do we know how many seniors are ending up in ERs because of this?
Yeah, so I think that's important. Like we shouldn't sensationalize and over play these findings too much. Our study covered from 2015 to 2022. And there's approximately 3 million seniors in Ontario, and over the course of our study period, there were 2,322 emergency department visits for cannabis poisoning. So overall, relatively small numbers, but I think a couple things bear attention when we talk about that. One, there is a clear signal here. Secondly, emergency departments are the tip of the iceberg. So there may be many people who have not realized what has happened to them and are, sort of suffering at home with cannabis poisoning. Secondly, some people may be presenting to primary care. And thirdly, when edible cannabis was legalized, it was immediately before the COVID-19 pandemic, where emergency department visits overall were lower. So this is the tip of the iceberg. It's small numbers overall, but there is a signal of increasing emergency department visits, and that's been actually seen in other jurisdictions with legalized cannabis, notably California, where between 2005 and 2019, California older adults have had an increasing rise of emergency departments specifically for cannabis toxicity, and poison control data from the United States shows a substantial proportion of those are actually from edible preparations. One
of the concerns when edibles were legalized was that, and you've mentioned this, kids perhaps might mistake them. You see a jar full of gummies and it might be, it's a sour key or something like that. Turns out perhaps it's more than that. With seniors, how are they susceptible to overdosing on cannabis because of an aging body?
Yeah, so one factor relates to edibles itself. So, for older adults who may have used cannabis decades ago and then picked it back up after legalization, they may have remembered the instantaneous high from inhaled preparations of cannabis. With edible cannabis, the onset of the high, the peak, is actually about 3 hours. And so if they're not feeling anything, they're liable to do something called dose stacking, where they take additional doses before peak effect has kicked in.
Because it's very different than smoking a joint.
Very different, where the onset is within minutes that someone gets that high. Secondly, contemporary cannabis is just much more potent than cannabis from even the 80s and early 90s. So the gummies or edible products have as much as 30 times more THC, or the psychoactive compound of cannabis, as compared to that dried cannabis flowers from the 80s or 90s. And then there are age-related factors that play a part here. So there are predictable declines in metabolism of cannabis, and changes in the fat composition of older adults' body actually means that cannabis sticks around longer. And then, of course, older adults are more likely to take other prescription medications. Some of those may be psychoactive. There are higher rates of cognitive impairment. So about 6.5% of the population in our study that ended up in the emergency department actually had dementia. And then they're more susceptible to falls and to sensory impairment. So when you combine, the contemporary potency of cannabis, the factors related to aging, you stack up that there is some increased risk for this population.
You said in some ways that ageism plays into how we talk about this to some degree. What did you mean by that?
Yeah, so I think often many people don't think of older adults like Bob talking so openly about using drugs and using drugs like many other age groups in society. But there's good data now for several years in Canada that following legalization, they are the age group with the highest increased use. And because of that, I think that impairs some of the ability or hinders some of the ability of healthcare practitioners to actually engage in conversations with older adults about their cannabis use. And so one of the takeaways for us is that healthcare providers should have open and judgment-free conversations about cannabis use, they can help them weigh the risks and the benefits by reviewing the health conditions, some of them that I spoke about, looking at their other medications. And also, because of those age-related changes, in the same way that when I prescribe a drug as a geriatrician, I follow a sort of a geriatric prescribing principle of start low, so start at a lower dose and go slow, so take a longer time to increase it. We believe the same thing should apply here when it comes to older adults. And that dosing instruction we should have some dosing specific guidance for older adults in cannabis products as well.
Just before I let you go, you could imagine this study's got a lot of attention here and in the United States, picked up by major news organizations. You could imagine there are some people who would say, given the low numbers, that this could sound a bit, like reefer madness or something like that, where people are worried about something, that this is going to change society. People are going to be flooding into emergency departments poisoned by this legal drug. That's not what you're saying, but you are saying that this is something we need to pay attention to. In the context of that, what do we do about this?
Yeah. So again, as you state, we should not sensationalize this, but there is a signal here. And as I mentioned, it's likely the tip of the iceberg because we're only capturing emergency department visits. So I think there are sort of three major takeaways I would list. One is that edible cannabis should be kept in locked locations in homes, and regulated cannabis actually comes in packaging that clearly states what the product is, but there is a large unregulated market and people also make their own edible products. So if you're doing that, it's important that's clearly labeled and marked and locked so that older adults can't get into this. And then for people like Bob and other seniors that are intentionally ingesting cannabis, one is to think about having something like senior-specific dosing guidance. Public awareness campaigns have a largely, the ones that older adults have become aware of in Canada are mostly related to driving under the influence, which is important. But there also needs to be some public awareness and information campaigns about conditions that might place individuals at higher risk for cannabis-related harms. And finally, it's about those open and judgment-free conversations with your healthcare providers to help older adults use cannabis more safely. So this is not legalization was bad. It led to a lot of harm. And this is not that abstinence is the only way forward here. It's that we've seen a signal. The signal has been seen in other jurisdictions. Now let's address it. And also for jurisdictions that are considering legalizing cannabis, let's try and prevent harm to older adults, which may occur if that jurisdiction does move ahead with legalization.
Nathan, thank you very much.
Thanks for having me. Appreciate it.
Dr. Nathan Stahl is a geriatrician at Mount Sinai Hospital, also the lead author of a report looking into cannabis poisoning in seniors. There are a lot of seniors who use cannabis for pain relief, and it's often self-prescribed. Dr. Hans Clark is a pain specialist at Toronto General Hospital, president of the Canadian Consortium for the Investigation of Cannabinoids. Dr. Clark, hello to you.
How you doing, Matt?
What do you see in your practice when it comes to cannabis use in seniors?
Well, I'll tell you, 1 in 3 patients that sit in my clinic want to know about cannabis. And not only do they want to know about it for pain control, they want to talk about it for sleep, anxiety, depression. The list goes on and on.
Do you worry, as Dr. Stahl does, about the possibility, whether it's inadvertent or just through lack of experience, lack of knowledge, of those seniors taking too much and ending up in his care?
So that's the crux of this question, right? And so, we need to determine if these ER visits are from the elderly using this for medical reasons, or is it a recreational scenario? Is it an accidental poisoning that, Dr. Stahl talked about? And what's clear, Matt, is that in 2018, before we legalized cannabis, 30% of Canadians were using cannabis for medical purposes and accessing it via physician. And the numbers as of last year are 18%. So you have this massive population of Canadians, and I would bet that the elderly fall into this population that are trying to access this product for medical reasons, and they just don't have the information nor the physician engagement in order to kind of get the information they need to use this safely. And so I think it's a real signal that we need the medical associations, we need our policymakers to really realize this is going to become a public health problem unless we invest into this. And, we did that legislative review of the Cannabis Act, and it was submitted to Parliament about a month ago. And there really should be some discussions in terms of what those findings were. And it was that we need to maintain a distinct medical access program with improvements to better support our Canadians.
What do you hear from your patients about why they want to take cannabis?
Well, there's multiple reasons. One, they're tired of medications that are not working, and the pharmaceutical medications, and so they want a plant-based product. That's one. The other is we just need some support, and we've heard so much about this from the media for the past 10 years about the great things that cannabis will do for me, whether it's CBD or THC, which is what we're really talking about this morning.
Can you just, for people who don't know, what's the difference between the two?
So cannabidiol is basically a molecule that will basically reduce inflammation and do some of these other things that are wonderful, and they don't cause you to get high. Tetrahydrocannabinol is the product that will have psychoactive properties and get you high. And I think Dr. Stahl was pretty insightful in saying start low and go slow, but we're talking about even more than that. Let's talk about standard dosing regimens. We have that for opioids. We should have that for THC or tetrahydrocannabinol. And somebody who has never used cannabis, Bob is a gentleman that's been using it for years recreationally, they can probably tolerate a bit more, but 2.5 milligrams is probably a standard dose. And many of these edible products that Canadians are turning to have much higher doses than 2.5 milligrams of THC. And really what we need to do is get to the place where we also understand as an elderly Canadian, as Dr. Stahl touched on, you might have cardiac conditions, renal conditions, reasons that these drugs hang around longer. And you're going to be in a state where, this isn't going as the way I thought. I don't have any medical guidance. And guess where I should land? I have to go to the Emerge to get some help.
Is there dosing guidelines for cannabis for pain management? Again, and one of the things that Dr. Stahl said is, the joints that people might have been smoking in the 60s and 70s are very different than the cannabis that people have access to right now.
Yeah, great stuff, Matt. So, 80% of Canadians are still consuming cannabis inhalationally. But from a medical perspective, we know smoking's bad. So we move our individuals towards oral products. And unfortunately, edibles have become very attractive. And so people start with something that they can ingest. But again, the onset of action is so slow that they end up taking too much of these products before they even get some of those medical effects. And so your question as to guidance, it's one of the things we talked about at our Canadian Pain Society national meeting with the government last month, and getting those dosing regimens and starting naive Canadians who've never used cannabis on doses that are appropriate. And so these are some of the discussions that need to start happening, in the medical circles in terms of how we go about doing that. And there are the Canadian Consortium for the Investigation of Cannabinoids have had a syllabus to educate physicians for quite some time. We're talking about re-upping that and actually updating that over the coming years. And so it is now time for us to really dedicate towards keeping Canadians safe as we talk about cannabis. Patients brought this into society. This was not driven by physicians. People have been telling us for decades how much benefit they're getting from cannabis. So now we have to catch up as a medical space in terms of making sure this stays safe for our Canadian population.
So we just have 30 seconds or so left. What is a word of advice that you would give to patients who are listening, people who are using cannabis, who are older Canadians, and they're trying to figure out what they should do safely?
Right. Ultimately, you need some medical guidance and you need some help. We're talking about getting some of these products into pharmacies, places that understand the other medications that you're on, the interactions with some of the drugs that you may be taking. And so it may be a struggle, but continue to approach your physicians, and this will move over time so that physicians are actually going to hopefully start to, as Dr. Stahl say, have those discussions, the non-judgmental discussions, because this isn't really the harm reduction space. We are talking about using this molecule as a medicine, and how do we use it safely? And so it's not akin to, an illicit opioid and all these other things we're talking about. This is something that is legal and is available to Canadians. And so we really have to hope that the medical associations really step up to the plate and create some education for our physicians.
Hans, thanks as always.
Thanks, Matt. Always a pleasure.
Dr. Hans Clark is a pain specialist at Toronto General Hospital and president of the Canadian Consortium for the Investigation of Cannabinoids.